Assalamu alaikum. This lab is about inside of the heart, the interior of the heart. I did my best to recollect the part of this heart because this part had been dissected to show the inside of it. And as you can see, I'm looking to the sternocostal anterior surface. We have to demonstrate the part. This is the right auricle, the auricle of the right atrium. This is the pulmonary trunk. This is the pulmonary trunk. This is the aorta, and this is the left auricle. This is the right ventricle. This is the left ventricle, and you can see this is the anterior interventricular artery running in between the right ventricle and left ventricle. So I will open first the right ventricle. Before I will start to describe the inside of the right ventricle, keep something in your mind, that each of the four chambers, the two atria and the two ventricles, shows from inside a smooth region and rough region. And starting from the right ventricle, the upper part, which is this part, is the smooth part of the right ventricle, which is called infundibulum of the right ventricle, while the lower part, which is this part, is the rough part of the right ventricle that contain many muscles. All of these are called trabeculocarinae muscles. And the ridge between the smooth upper part, which is the infundibulum, and the lower part containing the trabeculocarinae, this margin is called supraventricular crest. The muscles which are trabeculocarinae in the lower rough part of the right ventricle, some of them are just like a ridge. The others are in form of a bridge which is connected from side to side, but in the middle there is a space between it. In addition to the ridge of trabeculocarinae, bridges of trabeculocarinae, we have papillary-like muscles which are also part of the trabeculocarinae. So trabeculocarinae are ridges, bridges, and papillary muscles. Papillary muscles in the right ventricle are one anterior, attached to the anterior wall of the right ventricle, one posterior, attached to the posterior wall of the right ventricle, and there are many small papillary muscles which are septal papillary muscles, because they attach to this region, which is the septum between right ventricle and the left ventricle. So we have many small septal papillary muscles and one anterior and one posterior large papillary muscles. In addition to that, although this is the anterior papillary muscle, but it is displaced or detached from the anterior wall as an artifact during dissection. This is the anterior papillary muscle. You can see that there is a band, which is this one. This band, let me make it clear, this band is called moderator band or septomarginal band, because this band extends from the septum between the right ventricle and left ventricle to the margin of the anterior papillary muscle. So that is the septomarginal band. This is the septomarginal band. Of course, this is the cusp of tricuspid valve between the right ventricle and the right atrium. So I will push the forceps into the opening of the tricuspid valve into the right atrium, and you can see that all the papillary muscles, the anterior, this is the anterior, the posterior, this is the anterior, this is the posterior, and the septal are attached by cords to the cusp of tricuspid valve. These cords are called chorda tendini. There are many chorda tendini. And I'll repeat, this is the moderator band. This is the moderator band. It is extending from the interventricular septum. This is it. From the interventricular septum to the margin of the anterior papillary muscle. That's all about the inside of the right ventricle. And so I will close it, and I will pass to the inside of the left ventricle. Again, the inside of the left ventricle, let me put the cursor of the mouse. I will point by the cursor of the mouse in order to use my hand in opening the left ventricle. Again, the left ventricle is formed of an upper smooth part, which is called vestibule of the aorta, and a lower rough part that contains trabeculae carini. And again, trabeculae carini are ridges, bridges, and papillary muscles. So this is one of the papillary muscles, and that is the other. The papillary muscles are anterior and posterior papillary muscles. There is no septal papillary muscles, just like the right ventricle. And again, the papillary muscles are attached by cords. These are the cords to the cusp of mitral valve. So these are the chorda tendini. Just look to the wall of the left ventricle. How thick is the wall of the left ventricle? This is about 2 times thicker, or maybe more, than the wall of the right ventricle. And so this is all about the left ventricle. Vestibule, smooth part upper, rough part below, containing anterior papillary, posterior papillary with the other trabeculae carini. The papillary muscles are attached by chorda tendini to the cusp of mitral valve. And so I will close also the left ventricle as I had closed the right ventricle. And now I will pass to the right side of the heart, to the right atrium, and opening it. This is the right atrium. Again, the anterior wall of the right atrium, which is this one, is rough. The muscles making the roughness of the anterior wall are called pectineate muscles, while the posterior wall is smooth and is called sinus venarum. This sinus venarum contains above opening of the superior vena cava and below opening of the anterior vena cava. The margin between the rough part and the smooth part, which is this one, is called crista terminalis. The posterior part, which is the smooth part, contains a fossa-like structure, if you can see it. This is fossa ovalis. It lies in the middle. Above it is the opening of superior vena cava, below it is the opening of the inferior vena cava, and that is the fossa ovalis. It represents the posterior smooth part of the right atrium, which is called sinus venarum, that is in the interarterial septum. The fossa ovalis is the interarterial septum, and in embryology it was foramen between the right and left atria, which is called foramen ovalis. So you can see here clearly the fossa ovalis, and On the right side of the fossa ovalis, you may see the cusp of tricuspid valve. So this is the fossa ovalis and this is the cusp of tricuspid valve. And in between them, this is the opening of the coronary sinus. Between the fossa ovalis, that is interarterial septum, and the cusp of tricuspid valve, this is the opening of the coronary sinus, which is the big vein of the heart draining into the right atrium. That's all about the right atrium. And what is left is the left atrium. The left atrium, most of it is smooth, except for its small auricle that shows a small trabecular canal. And this left atrium is open because it is opened at the four pulmonary veins, opening of the four pulmonary veins. What is seen here clearly in the left atrium is this pit and that pit. Such pits are also seen in the right atrium and seen in all the other chambers. They are called pits of venae cordis minimi, that are small veins draining the walls of the heart. So you can see here some pits. This is 1, 2, 3, and these pits could be also examined in the right atrium, not only in the left atrium, and in all other chambers. They are the venae cordis minimi, venae cordis minimi of the heart, which are veins of the heart. Of course, we may look for the vessels here, but I don't want you to be disturbed. Another sample for the inside of the heart is this one. This sample had been demonstrated to you with the arteries. This is anterior interventricular branch of the left coronary artery that gives also a circumflex branch, but this sample also shows the marginal branch of right coronary artery at the lower border of the heart, and this is the right coronary artery. This is the right auricle. Yeah. And now I will open the right ventricle from this flap. I will open that. So again, this is the smooth upper part of the right ventricle, which is called infundibulum, and then a margin which is called supraventricular crest, and then lower part which is called rough part, containing trabecular carini in form of ridges, bridges, and papillary muscles. You can see this is the anterior papillary muscles attached by chorda tendini to the cusp of mitral valve, while that is the posterior papillary muscle, and there are many other small papillary muscles. You can see here, this is the anterior papillary muscle, and you can see this is the moderator band attached to the margin of the anterior papillary muscle. This is the anterior papillary muscle, this is the moderator band, and that is the posterior papillary muscle. Here the moderator band is so clearly seen because we didn't disturb the anterior papillary muscle. Actually, this sample had been put or used as a demonstration for the moderator band only. Of course, this is the pulmonary trunk, this is the aorta. I think no one could see only the video without examining the heart samples, and then he can answer the exam. You must see the sample after the video. This is a cross-section of the heart, which is very nice, and it is very similar to what is seen in echocardiogram. You can see how the left ventricle is circular in its lumen, having a thicker wall than the semilunar right ventricle in cross-section, and you can see this view on echocardiogram. And actually, I can keep on re-describing here papillary muscles, right atrium, fossa ovalis, everything, left atrium, but I think it's your duty to look after this sample, which is an additional sample. You know, the heart is so small, and I have to prepare two samples for you. One of them is that, and the other is that sample. We have another sample. This is both of these, that one and that one, are open for the 4 chambers because your number is so large, and we put two samples with the same demo. You have to look for them. Thank you very much.